afternoon, everyone. Today I'm going to administer oral application. So first step is you need to perform hand hygiene.
So next is don't use gloves.
Then next is to verify the medication, adhering the 10 rights of drug administration. Then next is to prepare the equipments needed. Then next is to identify the patient by reading the identification bracelet and by asking the patient's name to ensure that you are administering the correct patient. So ma'am, can I ask your name? Then next is to explain the procedure and the purpose of the drug. So ma'am, the purpose of this drug is to boost your immune system. Then after, next is to verify any allergies on medication record or electronic record. Then next is
Explain
done gloves if necessary, or if there are any possibilities of oral exposure situation.
Next
Exposure of oral
is open the medication and give it to the patient. And assist the patient. Follow it with a okay. Next is check the mouth of the patient. Next is we will administer the medication.
Next is to open the patient copy and place on the patient's hand. And assist the patient.
After that is
Remain with patient.
reposition the patient and remove the side rails. And
If she already taken the
lift the side
medication,
rails.
shut the mouth.
And
Then after
next is
administer liquid
discard the equipments.
make sure
Next is
and
note
instruct the
if
patient
the patient refused the drug, just leave the drug beside in the bedside. Next is if the drug is unopened, put it in the cabinet, and if the drug
Next,
is
leave
open,
side.
flush it
Next
in the
is,
sink or in the toilet
place
with
the call light
And next is
and
remove gloves.
leave the side rails and remove and discard
Perform
or
and
restore
maintain
the
and
medication
document the
packages.
medication.
Then next is note if the medication,
Assist the patient
if the
30
patient
to
refuses
60
to
minutes
drink the
after the
medication,
medication.
then not leave the medication on the bedside of the patient. Then note if the patient, if the medication are unopened, put it back at the medication cabinet or drawer. Then next, note if the medication are open, flush it or sink it, and possible with witness. Then next to remove gloves and perform hand hygiene. Then document the medication and assess the patient after 30 to 60 minutes if there are any reactions to the medication.